Hi, this is Sam Brasch. I'm the Senior Managing Director with Kaiser Permanente Ventures. Thank you all for joining us. We're excited to have the conversation today about how to survive and thrive in the new normal beyond COVID-19. Have a focused conversation about what the role of behavioral health technology is going to be as we all figure out how to move forward. I'm excited to be joined today by two folks from Ginger, a company in the KPV portfolio, Russ Glass, who is the CEO, and Connie Pulmano, who is one of the behavioral health coaches. And we'll get to both of them later, and excited to hear and discuss with them what they're seeing and how we think we can best meet the needs of individuals out there in this moment. Stepping back for a moment, it's not lost on any of us, I think, that there were and continue to be significant needs in the mental and behavioral health space well before COVID showed up. As a healthcare system, as a society, we were challenged to meet the really increasing demand for mental behavioral health care. And again, as we all unfortunately know, COVID-19 has only exacerbated the crisis. The early data is pretty overwhelming in terms of the stress and anxiety that people are feeling in this moment, both in their day-to-day activities, as they think about their work and the economy, and of course, they think about their and their family's health. This, not surprisingly, has put a pretty significant demand on the delivery of mental health care across the board in the US. We're seeing it at the lower acuity levels with people increasing the feeling of stress and anxiety, and we're seeing it at the higher acuity levels with people showing up to the healthcare delivery system really in pretty dire need for care and support. The big question that I think a lot of us in healthcare, a lot of us in the innovation world have is, what are we going to do to continue to address the challenges we have in terms of meeting this demand? With a shortage of services already available pre-COVID, we recognize it's only getting harder to meet the expectations out there. But the one thing, that gets us, at least, when we sit at the KP Ventures platform and we see some of the companies like Ginger out there, is we do see a pretty exciting opportunity for the use of digital healthcare. Some of the virtual engagement that we're starting to see and that we're going to talk about later today, is really accelerating in this moment and really helping to identify and validate how valuable virtual care can be in the overall delivery of care services. As we talked about at the beginning, Kaiser Permanente invested in Ginger, 6 or 7 years ago now. Back then we knew that there was unmet need or unmet supply for the demand that was out there. And again, that's only increasing. As we've seen, Ginger grow, it's been really impressive, and we're excited to hear from Russ and Connie about what they're seeing. But it's been very impressive for us to see how they can meet people and really deliver care in a way that seems to really satisfy and match and in some ways exceed expectations. With that, I'll welcome the CEO of Ginger, Russ Glass. And as I mentioned, we'll get to Connie Pulmano in a moment. But let's start with Russ. Russ, can you tell us a little bit more about Ginger and how you all fit into the overall mental and behavioral health industry landscape right now?
Sure. Yeah, thanks, Sam. Great to be doing this with you. If you look at the mental health system, let's put COVID aside for a second, and you look at the system pre-COVID, it was already wildly overburdened and overtaxed. Some of the incredible stats out there. One is that 50% of U.S. counties have 0 mental health providers within county lines. Of the 20% of the U.S. population that has a diagnosed mental health condition, 60% of them aren't getting any care today. So you've got this huge issue where you have so many people that have a need, and we don't have enough providers to solve for that need. And anxiety rates were going up, depression rates were going up, suicidality rates were going up, and yet the number of providers going into the space are shrinking. So huge demand pre-COVID. All of a sudden, global pandemic comes along, and you take a difficult situation and you put exponential stresses on it. And so now you have a situation where you see massively accelerating need. People are more acute, so they're coming in at a more clinical need level. We're seeing conversations get far more intense than they were prior. And we've talked a little bit about you read about the second wave that's coming behind the pandemic, which is the mental health crisis. And we haven't even seen that yet, that notion of this new normal that we're going to be in over a period of time. And Ginger built a system to really tackle this original problem of supply-demand imbalance. And it turns out that during this period, we're an interesting solution for this increase in need. And there's a few things we've done to build the system in this way. First of all, we recognize this supply-demand imbalance wasn't going to get solved with just more providers. You can't just take this standard network approach. We also recognize that there's all kinds of advantage you get from applying technology, measurement, personalization of care to the delivery of mental health care. And then finally, bringing in people like Connie, behavioral health coaches, to help build a collaborative care model that is a combination of coaching, therapy, and psychiatry, depending on the person's need. And when you tie all that together, when you show up at Ginger, within 60 seconds, 24/7, you're talking to a live behavioral health coach via a chat-based application. That interaction is rich, that coach is longitudinal. If you have more need, we'll bring a therapist or a psychiatrist if med management is needed into the care team. So now you have a coach and a therapist, or a coach and a therapist and a psychiatrist, and those providers start collaborating together. And the whole goal is get you healthy as soon as possible, step you down from that higher level of care so that you can continue to work with your coach over time. And then we tie all kinds of content, activity cards, exercises into that to help you move towards self-care over time. And the net is we are getting people healthier at 4 times the rate of the standard of care on one side, and on the other side at far less cost. And, you know, a period like now, we're hopeful that our system can really help as these needs go from really bad to worse.
Yeah, I'm curious, you know, and as we think about the value proposition from Ginger pre-COVID to now, you know, we all, I think, are recognizing that virtual care in this moment is required, of course, and proving to work well. But I'd love for you to reflect on, like, what was the valuable aspects of the virtual care model pre-COVID? And I'm curious, are there different value propositions that are being, you know, made evident now, or is it just building on the same?
I think the value propositions are largely the same. The difference is that the need for trying something digital has gone through the roof.
Yeah.
Because the value prop prior of being able to access someone 24/7, of not having to leave your house and the comfort of, you know, sitting on your couch versus, you know, getting in the car, showing up at an office, those value props existed. But now, you know, you have the added layer of, and you might not get sick with COVID.
Yeah.
And so, you know, what's happened is you've seen this massive acceleration of adoption. You know, we saw a stat in a survey we did that about 40% of the population has tried some sort of digital mental health application in total. And of that 40%, 60% have tried it for the first time in the last 4 weeks.
And this is just this is mental health application. It's not all digital, all virtual. But oh wow.
That's right. So 60% of that portion of the population has tried it for the first time in the last 4 weeks. So you just see the acceleration of need. Mm-hmm. And I think what's powerful about that is that once you've tried it, once you've experienced telehealth, whether it be mental health or physical health, you realize how great it is. You realize that, oh, you really can get a lot accomplished in a much more, you know, frictionless way. And so my hope is it'll reduce the cost of care over time. It'll be very sticky as people recognize the value of it. And you know, will help to solve some of those supply-demand imbalances that we see out there.
Yeah, and I'm curious, you know, parts of the Kaiser Permanente system are working with Ginger, you know, in the delivery of care for some of our members, but the majority of your customers are employers who are, you know, engaging with you directly. What are you hearing from them, you know, in terms of their take on the need of their employee base and how they're thinking about this, facing both, COVID and health issues, as well as just obviously economic challenges.
Sure. I mean, pre-COVID, what we heard most often was, I can't get access to care. So employees are calling their health plan, they're calling their EAP, and they are not finding providers that are available. Ginger actually did our own study on this just to see what the state of the industry was. We called 150 providers across 3 different regions, 3 different geos. I think LA, Seattle, and maybe Atlanta was the other one. And 70% never returned our call. 12%, the phone line was dead.
These were you guys calling the providers on some list of available in-network providers?
Exactly. Ostensibly a great list.
Yeah. The curated list that went to phone lines that have been disconnected.
That's exactly right. So 12% phone line was dead. 12% the provider actually answered and said, we're not taking new patients.
Yeah. And
then the remainder, about 6% or so, said, we can get you a telehealth appointment within the next 2 weeks. Wow. So, and who knows the quality of those people? Who knows actually how good they are, or what kind of fit they are with who you are? Yeah. It's just, they're a warm body that actually could talk to you.
Yeah.
That's the state of what's going on. And so employers are recognizing that increasingly employees need care that they can't find. And with COVID, they're also recognizing now that even just business continuity planning, even just making sure your people have what they need in a period of, they're worried about getting sick, they're worried about their parents getting sick, they've got their kids at home, distance learning, and they're trying to balance those 2 things. Their partner's out of a job, and so their income's been cut in half. They're worried about their own job. All these stressors on top of it, they realize they need some sort of robust access to mental health care just to continue to be functional as an employee.
I know my bosses think I need that, so it makes sense to me.
Given the time you and I have spent together, I think they might be okay. They might have something there.
Hey, Connie, I'm real curious on your experience. I mean, you're engaging with people day to day, but maybe before we talk about what you're seeing, could you describe what it means to be a behavioral health coach and then what it means to do that through a virtual platform?
Yeah, that's a really good question. A coach in of itself is a professional who comes alongside someone and helps them really figure out what is it in their life that they want to change or to grow. And a behavioral health coach is unique in that we're able to get into that mental health space with them and look at mental health concerns and things that they're experiencing in ways that others aren't able to do. So for example, as people experience things like anxiety and stress and not sleeping and the normal things that can come along with different mental health experiences, a behavioral health coach can get in there and use things like motivational interviewing. We use a lot of CBT. We use a lot of cognitive reframing is very important with that thought process, but we do it in a way that's thinking forward, whereas therapy is more about processing what's past and what's deep. Coaching is about, let's talk about what's right now and let's talk about where you want to be and start building those stepping stones to get there. And what's unique about behavioral health coaching, I think people have heard of things like life coaching and other types of coaching, which are very valuable. Behavioral health coaching gets a little bit more into that gray area with people that can create a plan to help somebody begin to feel better. And that often is in tandem with our clinical services, therapy and psychiatry. And also it's unique in that we draw from the person's strength and the resources that they have now, and then start to kind of push them a little bit to start discovering new resources while also adding resources to them. And it's a really unique and a special way to address mental health, and it's also been shown to be very effective because the goal is to have the person be empowered in their own strengths to make those changes rather than have those changes made for them. So it's less about creating a care plan for them, and instead we partner alongside them to create a care plan that they kind of come up with based on where they're at now, and also building courage to find things that they can utilize to go forward.
Great, and I'm going to get to the COVID moment in a second, but I'm curious, just your experience as a behavioral health coach, what are the benefits and the challenges of doing it through a virtual platform?
I would say the benefits of doing it through the virtual platform is what we know about any type of virtual platform, whether it be social media or texting or where you don't actually have that face-to-face. One of the values to that is people can tend to be more vulnerable and feel less shame and not really worry about, what do I look like? What does my room look like? Or am I feeling uncomfortable going into a space with somebody? They can sit in the comfort of their own home or their own safe place of wherever they're at and have these really deep and meaningful conversations with their coach where they may not otherwise do that. And what I've found in working with people in this platform is, which is different from working with people face-to-face, is that people tend to say things like, I actually like this because I feel like I'm more comfortable in my room, or I can be more comfortable just reaching out to my coach on my lunch hour because I've just had a really stressful meeting and my imposter syndrome is flaring like crazy right now. Yeah. And they're able to just have that access right now. And that's what makes it very unique. The challenges of coaching in this way is, on the other side of that coin, is that you don't have that face-to-face. You don't see the nonverbal cues. You can't read faces. You can't kind of you can't see the unspoken behind the spoken, which is very much, at least in my experience, what we learn to do when you're working with people. So you learn to adapt to that by what are you hearing and what they're saying, and using a lot of clarifying statements and being very, very intentional about how you respond and how you communicate, because in that written word, because we can't see and we can't sense what people are feeling in front of us, we tend to fill in those blanks. And so it takes a lot of finessing that conversation and backing off and pushing forward to use the words that are going to communicate what you're trying to say. And then sometimes backpedaling and saying, I'm not sure what I said felt right. Let me try that again. Yeah. And so it takes a lot of humility and building that close rapport with people. And I actually have found that I prefer this type of work with people because of that vulnerability that people can feel more safe in.
Yeah, one question, this is to both of you, whoever wants to answer it first. When people talk about telehealth, they talk about, some of the value is just the piping. You're creating a mechanism through the phone to engage with someone through text or video or phone calls. But I know, because we're an investor in the company and I'm close to you, that when we think about virtual care and the power of a virtual care platform, there's also important technology components to that add to the overall, impact and effect of the experience. I'm curious for both of you, and looking at from your individual perspectives, what's the role of technology beyond just the conduit, the text-based communication that is possible in virtual care and that we think will be either already showing value or will be valuable longer term?
Do you want to start, Connie?
I'll let you start if that's okay.
Yeah, that's fine. I'm happy to. I think, bringing technology to bear against problems like this has immense opportunity to pull the costs out of care, to kind of bend that supply-demand imbalance that I talked about. And there are a number of things that we're doing, and I think others are doing out there in this vein. One is, part of the reason from a technology standpoint that chat-based coaching and care is so valuable is not only does it allow for some of what Connie just described, but it's a highly scalable mechanism. So you can communicate very efficiently that way with your membership. You also have a very structured text base to bring into machine learning and AI. And you can use that information along with capturing data about people's scores, like their PHQ and GAD scores, their ratings about how they feel like things are going, things that they've said in the past, and compare it to others that you've seen go through your system in order to make smarter and smarter decisions. And those decisions, we then can push real time to our coaches to give them better insight into what a next best action might look like, into there's suicide risk here based on the trends we've seen over time, or this person is a candidate for clinical escalation due to XYZ. So those types of things, we really can superpower our care team. And there's a few effects of that. One is just quality. It allows us to maintain a level of quality over time that you couldn't possibly do if you didn't have this kind of technology. Two is it allows us to improve over time. So every single session is actually improving the quality of our care because we're using that data to see how people are doing and feed that back into our algorithms, feed that back into our personalization. And as you continue to get smarter and smarter, you can handle more people. They get healthy faster. You reduce the cost of care. You create efficiencies. And so I think it's not only valuable, but it's critical if we're going to end up really bending these cost curves going into the future.
Yeah. And it was, you know, it was a funny question because I already knew and agree with your answer. But Connie, I'm really curious about, you know, your perspective, you know, in your day-to-day, moment-to-moment interactions with individuals, you know, what's the role that technology is playing beyond just the virtual conduit?
Yeah, that's a great question. And just to kind of tail from what Russ said is on my end or on the end of the coach, first and foremost, having that support that he described of those scores, of just watching in the back end what's going on with somebody is very helpful from a coaching perspective, because then we have that to support to get those flags, to have that kind of precursor coming through to us to say this person may have some escalated needs, and be able to have our conversations kind of go in that direction to decide whether or not there actually is a risk of suicide or other higher risk. And also that support to push out and say, we think that this person needs a higher level of care because of what we've seen with the scores and also what we have assessed. The other benefit that I've experienced and we've experienced as coaches is that ability to push out information to the user as well. So we have a lot of great content that we utilize, and there's a lot of benefit to, say, in session, for example, somebody is struggling, say, with their anxiety's through the roof. You say, what's your anxiety on a scale of 0 to 10? They say, right now I feel like it's about a 12. Okay, well, let's stop what we're doing.
That's all of us right now.
Exactly. Let's focus on that. And pushing them this content of a breathing exercise or some sort of visualization exercise that helps them in the moment be able to de-escalate, so that now we can get into those parts of their brains that can start processing what we need to process to do a coaching session. Yeah. And those are, I think, the two things that stand out the most for me when I think the technology that we use.
Okay. And you were actually just trying to get to this a little bit, but you know, we talked about your experience as a behavioral health coach in general, but I'm really interested in this COVID moment. How is it different, if at all? You know, how are people showing up? Are they showing up differently? Are you feeling a different, you know, any new challenges in how you engage with people?
Absolutely. And we started seeing people show up with concerns about COVID around as early as January. I believe it was around January 24th, we started to see that. And we started to hear things like this virus that's coming out, and we're afraid and we have fear and we don't know whether we're going to survive or mom's going to survive, what's going on. So there already started to be this uptick of use. And then over the course of those several weeks, we saw the coaching usage increase, I think close to over 100%, I think close to like 107% of users for coaching. And that's in our weekly number of active coaching users. So definitely COVID had an impact on people reaching out for support in the moment, and reaching out for in the moment support. And what I mean by that is reaching out and saying, I'm ready to get set up with coaching is different from somebody reaching out and saying, I'm having that panic attack right now because I'm very scared. And adjusting our coaching structure to decide and work with the person to make that split-second decision of, does this person need to get set up with coaching, or do we need to do in-the-moment support and get them de-escalated, get them the tools they need right now so that they can feel calm now, and then we can come back to the coaching setup later.
So go ahead, please.
Well, I was going to say, we have seen those numbers plateau a bit, and we've also seen an uptick in use of our clinical services as well. And I've noticed as a coach, I do a lot more asking about whether the individual feels that adding therapy might be something beneficial, and a definite increase of people saying, yeah, actually I think that would be a good idea. And then talking through the why of how coaching and therapy work together in tandem with one another.
Yeah, and this brings up a more general question of, I'm curious, what kind of measurement you all do of, the individuals and the populations you serve, and in understanding that, I'm curious, are you seeing, higher acuity, different types of scores today, either people showing up or bigger or easier opportunities in terms of addressing them? So maybe I'll just start with the first question, which is, what do you do today to measure both, the acuity of the patients that you're interacting with and the outcomes you're generating?
So we measure across a number of different, both sort of activities and screens. And, one of the core beliefs here is that measurement-based care is critical, again, to creating more scalability and getting people healthy faster. I think one of the problems in the space more broadly today is there's very little measurement.
Yep.
You go into therapy, you go into coaching, and there's really no metrics attached to how long should you stay there. So a weird paradox is many people don't get access to care, but many people get access to too much care. And so we look at everything from, how is the person self-reporting the sessions are going? So a 5-star scale on, how I feel about these sessions after each session, to standard measures of mental health care or mental health needs of the PHQ, which measures depression, the GAD, which measures anxiety. We're looking at pre and post kind of exercise checks. How are you doing before an activity? How are you doing after an activity? And basically, we're also looking at more broad measures, such as how fast is somebody either getting healthier or not getting healthier, and comparing that to what we've seen historically. And all of this then goes into, again, what are the care pathways? What are next steps that we want to move forward with this person? Interestingly, research has shown just measuring improves outcomes by 20 to 60% in the mental health space. So even just the act of having a measure is going to significantly improve outcomes. And, it's intuitive, because if you have a measure, it helps you to make decisions, but it's amazing how little of it is done out there.
Yep.
So everything we're doing is tuned towards that kind of measurement. And I think, again, back to the technology question, the fact that we're doing all of this online, the fact that we're doing this in a digital way, makes that capturing of data far easier than if you were doing it in person and not assisted by technology like this.
And then I guess one of my questions is, in this COVID moment, and maybe it's just too early to know, as Ginger is able to measure across a population, how both how severe is the anxiety and mental health challenge across folks at large, and then are we able to, we being you and the healthcare delivery system, are we able to address it as effectively in this moment? I mean, COVID's such an uncertain time. Have the rules changed? Is the things that we could do to take someone from one level of severity to another level no longer as effective in this moment? Or so I'm curious from both of you. Do we have any insights yet?
I would say, from my perspective, I think for sure the collaborative model that we have is what makes that very possible, because what we do see are people who are feeling very high in anxiety. They're feeling at the beginning of COVID, when this, people started trickling in, feeling very unsure and feeling very uncertain. And while they still feel that way and come in, seeing that over time through the work, through coaching and utilizing the tools that we provide, being present with their coach, and then adding the clinical services, we've definitely seen people come through this in a way where it's actually building this resiliency in them. And I think that collaborative model that we have is definitely what makes that unique for us, I would say. And also, as we've talked about before, the fact that people are more apt to reach out and accept the help now and to utilize the service now, because I think a lot of people with people working from home, which creates a lot of anxiety. People aren't used to that container of space, right? We're used to these containers of spaces in these offices, and it feels very different. That creates a lot of uncertainty and anxiety, homeschooling, and all of the other things that have come along. Many people have gotten to this breaking point of sorts where they say, I need help. And to have a platform like we have with that coach in the moment to say, let's talk about what that help can look like, and then those undergirding of those clinical services creates this very successful model for people, especially now with everything going on, not just with COVID, but now with all the political climate and the elections coming up, and this building and mounting uncertainty that we're experiencing.
You're saying there's more than enough to be stressed and anxious about right now?
I think so. I think that's a gross understatement, yes.
What I'd add to that just briefly is, to your question of measurement again and what we're seeing. One is, so not only are we measuring the member side and how they're doing, but we're also measuring the provider side. So how are coaches doing and how are our support teams doing? And basically, again, it's relatively straightforward. 3 times during a coach's shift, they're going to be asked, how intense are your conversations? And it's, 1 easy session, easy day, all the way to 5 super hard.
Yeah.
And the first insight is we've seen intensity go up during this period by about 20% or so. So seeing from the high 2s on average into kind of the mid 3s as where we're seeing it come in today. The second thing that we're measuring is just how acute are people coming in. And we're seeing about a 10% increase in acuity. So about 10% more of the people who are showing up ready or at a level where clinical services are more appropriate compared to the pre-COVID period. So, you're seeing it on both sides, more intense conversations, more acute populations, and we expect that to continue into the foreseeable future.
Yeah, and one last question. I think we all spent, at least in the healthcare space, we spent the first few weeks, first month of COVID marveling at, for lack of a better term, the increase in virtual visits across healthcare, not just mental behavioral health. A place like Kaiser Permanente that, we approximated that maybe 10-ish up to 15% of our interactions with our members were virtual visits, a lot of emails, phone calls, and some video stuff. Now, out of necessity, it's up to 85, 90% of interactions. And the new parlor game for a lot of folks in our space is, what's the new normal? Where is this going to, level out at as, we emerge over the months and years outside of COVID? I'm very curious in the mental and behavioral health space because it's a unique population. There's unique needs. Obviously, as you guys have articulated, the demand is there. People are showing up. They're feeling stressed and anxious, and they're able to get care through Ginger and other virtual solutions. But, do you predict that, we go back and normalize to lots of people still want to be there in person? Or, how do you see the future in terms of the role of virtual care in this mental and behavioral health space?
I'll start. I'm very interested in your feedback. My perspective, and I think this was our perspective pre-COVID, was that the behavioral health space is the ideal space for telehealth. From the standpoint of, you don't need to be poked and prodded. You don't need blood draws. You don't need a lot of the stuff that you may need in a physical health environment. And so our thesis was always that we would actually lead the way in the mental health space and behavioral health space in terms of telehealth adoption. And I think what COVID has done is accelerated that because of the nature of the pandemic. And I expect it to be very sticky based on the ratings we have coming in of 4.7, 4.8, 4.9 out of 5 stars. When people engage this way, they really love it. And I think that's going to be very sticky.
Connie, any perspectives from you on whether or not people will, who are showing up maybe for the first time for virtual care, are going to stick with it or want to go back to in-person?
I experience very few members who, once they start to experience the benefit of that virtual platform and that on-demand platform that we have, wanting to go to a in-person face-to-face platform. I experienced that very, very, very few members do I experience that with. Maybe there's less than a handful that say, I think face-to-face is going to feel better for me. And my assumption is based on what Russ has shared, the data that we have, my assumption is that because we have so many people utilizing it for the first time and benefiting from it, that's just going to balloon. And they're going to continue to benefit from it and tell their friends and their families and the people around them who say, wow, you seem different. And they say, well, let me tell you why. Right? People want what others have when they see that it's working. And so I anticipate and hope and am excited to see this really become a thing and a big thing, especially now. I think the timing couldn't be better.
Yeah, well, we agree. And again, I'm way over time, so I'll wrap it up here. But Connie and Russ, thank you both so much for taking the time. This is a challenging moment, and I know that solutions like Ginger and what you're doing on a day-to-day basis, Connie, are really important for a lot of people. So thanks for doing what you do, and thanks for taking a few moments to chat with us here today.
Okay, thanks for having me.
Thanks.
Thank you.
All right.
Bye.